A lot of us spend time outside this time of year, maybe doing some yard work, going to the beach, but before we do anything, so important to put on that sunblock. So we're here at Advanced Dermatology and Skincare with Dr. Bender. SPF. Does it really matter how high the SPF is? Is it necessarily better?
You don't want to go below a 40. You want to stay in that 40 to 50 range, and you're going to be fine. But the most important thing is not necessarily the SPF, it's what is in the sunscreen. So you really want to make sure that you're using a sunscreen that has zinc oxide, titanium dioxide, and the importance there is it's physical blockers. It's actually reflecting the light. The chemical blockers, even the better products that are over the counter, they use chemical blockers primarily. That can cause irritation after sun exposure, which of course we don't want that. We don't want to give anyone an extra excuse not to wear sunscreen.
Right.
Zinc oxide is a physical blocker. It's reflecting the light. It's like putting this little force field on your skin, protecting you from the UV rays.
Okay, and UV rays, UVA, UVB, what's the difference there?
Well, UVA actually will penetrate the skin and actually can decrease your immune system. And we used to think that UVA didn't cause skin cancer, but now we know that it does. It also penetrates through window glass. So if you're sitting, in your car, for example, you're getting some UV radiation through the windows, you're getting UVA. UVB is, what's going to give you a sunburn. So that's what you're primarily getting when you're outside. But again, it's not as important to know all that if you have a physical blocker.
And if you're not using the sunscreen, the sunblock, it could result in skin cancer. So what do we need to look for? What does skin cancer look like?
Well, of course, there's different types of skin cancer. There's basal cell carcinoma, there's squamous cell carcinoma, and then the one that we all fear, melanoma. And what I tell patients is, you have a new spot, that's something that we need to check. You have a spot that's starting to look different than the rest of what you have, that's something that the board-certified dermatologist should check for you. And of course, when a patient comes into us, if it's something that's concerning, we'll do a little biopsy, and we can do that in 5 or 10 minutes. They leave with a Band-Aid. It's not going to slow them down one bit, and then we'll know exactly what it is, and we can treat it appropriately.
When is it cause for concern? When should you go see a dermatologist?
Well, certainly anyone who's had a history of skin cancer, anyone who has had a history of precancerous, spots are being frozen off and whatnot, and even folks who have maybe a sister or brother, parent, grandparent with a history of melanoma should be seeing a board-certified dermatologist for their skin care.
Let's say we don't have any history of skin cancer in our family. How often should we be seeing a board-certified dermatologist?
Well, once a year. That situation would be fine. And then, of course, if you start having the precancerous lesions and or the skin cancer, then it's going to be a little more frequent. Maybe it's every 6 months, maybe it's as much as every 3 or 4 months. Okay,
one thing, gentlemen may not realize this, but you can get skin cancer on your head. You shave your head, maybe you have a bald spot. You can take care of that, give them a little hair here, right?
We can. We have the NeoGraft method for hair transplantation. It is the most advanced method for hair transplantation. The reason that it's the most advanced, instead of the strip method where you're actually cutting out part of the scalp, this allows us to take out by the follicle. So it's a 1 millimeter punch, real tiny. And so those little spots will heal up in just a few days. It's like you never had the procedure. Men and women, for that matter, can wear the hair in the back the way they so choose. If they want to cut it short, if they even want to shave that later on, they can, because there's no scarring. And then, of course, we put those where we need it up top. And
you have a special going this month?
We do, 50% off.
Hey, even better. Okay, so again, just protecting yourself from the sun is really so important because we like being out in the sun, getting a little bit of vitamin D. So just protect yourself, and if you have any questions, come and see Dr. Bender here at Advanced Dermatology and Skincare Center.